Namaste, Dr. Amita Phadnis here, Director of Oyster and Pearl Group of Hospitals, continuing in our series Aarogya Katta, and as we say, health talks or conversations about health, which will give you a lot of information on different aspects of medicine and surgery. So today we have Dr. Ashish Arbat with us, a renowned orthopedic surgeon, renowned joint replacement surgeon, and he is going to answer a couple of my questions today. So, Dr. Arbat, robotic surgery, especially with reference to joint replacement, is a in thing. I think in medicine there are always flavors of the season. So, the current flavor is robotic surgery. So, would you say that it is correct to say that robotic surgery is better than conventional surgery, or is that a myth?
Madam, there's a plethora of robos and technology that have come, and technology always gives better results. So answering your question, definitely it is better than the conventional one in terms of engineering. And why would we call it that it is better? Because orthopedic results are depending on engineering betterment, and whatever research is happening is to make. There are two things that orthopedic research goes on, is to increase the longevity of the joint and to give patient comfort. So basically robotics is nothing that some robo is going to come and operate. In orthopedics, robotics is mostly related to knowing the patient's anatomy, what are the angles, and helping the surgeon who is already well trained. So we are doing robotics from 2014.
Wow.
And to help the surgeon like a first assistant to guide what the patient's angle. Now robos, we have a lot of data feeded in the robos, and we can place the best implant that fit the surgeon and fit the patient, and it helps the surgeon to give excellent post-operative result and a long-term survival of the particular implant, which can be double of what it is. And that's why overall picture feels that if you are trained well in robotics and you are not experimenting in robotics, there are some places where you just buy a robo and then start it. There are people like us who have been working in it since last 10 years. So these definitely help us in getting out the best of the implant, best of the surgical. So definitely robotics is there to stay, but in terms of who does it and how experienced the surgeon is. So it should not be used as a marketing tool, ma'am.
Absolutely.
And if you have robotics, it's good. I'm against marketing it just to show that we have a robo and we give good results. It's ultimately the surgeon who gives the good results.
So as in every field is the man behind the machine, or sometimes the woman behind the machine, which makes all the difference. And Dr. Arbat, another question here. We hear about many different robotic equipments in the market. So could you share your thoughts on which robotic equipments are good, or something, a little more information, because we just hear robotics.
So basically robotics as a term, it signifies that what increases the quality of work of a human being. So first of all, robo has to never be above our head. So when it started, robotics started with the Da Vinci for the abdomen, so that surgeon sits outside or a gynecologist sits outside and operates. But in orthopedics, the robotics is all about like a GPS system, what I told in the last talk, more of a navigation. So it started with navigation. It was one dimensional. So we used to know the angles of the knee, or say particularly it started with the knee, and then the research started happening, and then it came in 2 dimensions. So they were pinned arrays that were placed, and we have a lot of videos online, people can watch it. And then now we have something, last 3 years back we had robotic arms assisting us for taking a cut in the TKR or THR, but now it is moved one step above. Like everywhere the robotics is going, it is becoming completely AI. So now the robo is not seen. So what is the basic idea, ma'am, is we study the patient in a CT scan. So there are 2 types of robos. One is image based, which were the initial robos, some centers still have them. So the surgeon image less robos are, you open the patient, place those arrays and use the navigation for the knee. But what we found in them is image based, image less robos it was again a surgical error. It was better than conventional, but we had no idea of the angles of the patient. Those robos are used for taking a beta cat and fitting the implant better. But above it now, what we do is now something called as image-based robotics. What are those image-based robotics? Is AI. It is completely AI. We depend on a CT scan. When the CT scan goes in the AI has data of more than 10 lakh patients been operated previously, and their ergonomics, their ethnicity, and a lot of stuff. And we get a plan to how this, what are the angles of the patient in 3 dimensions. That's what we are using now. And that guides us to place the implant in 3 dimension. So it is patient specific implantation. So now the robos also have gone into complete AI, and here we use the data for the betterment of the patient. So now robotics is going in AI. So it is there in the system, but it doesn't exist. And now we are getting this year a new robo, ma'am, where we are going to wear the mask, and might be this November or December we'll just launch it, and it is going to be with us like Iron Man. So my arms are, this is called phygital technology. It was initially digital, then it became robotic arm. Now the surgeon itself, I'm going to wear the armor. So it's going to help me. I know the patient's angles, and he or she, whatever the AI is, say Lucy, she is going to be there in front of me, and she is going to assist me while operating. So it is definitely to stay. It definitely will
give. The word is the precision.
The precision, and it helps us.
So one other thought here is, as lay people, most of the people think, when they think of a robo, it's that robo that is standing there.
Iron Man.
So, and I'm sure they still think that way. So is it that way, or is it now a different?
It is not that way. It is. You can compare it to the. You can compare it to the Iron Man thing. If once the armor goes out, he's a normal man. When I wear it, it increases my ability. But same armor used by somebody else, he becomes a villain, or
absolutely.
It is you, ultimately the surgeon. And once you reach, like they say now, once you reach a particular level in singing, you become a pandit, and then you want to discover a new raga.
Correct.
So this is, well, first of all, you have to become a pandit. You need to have the conventional numbers. And what is happening now is people are buying robo and then starting the TKR. It should be whatever people have done.
So the person behind the machine.
Person behind the
most
machine,
important.
Or the AI. See, machine learning is very slow, ma'am, but the execution is quite good. Saying that robotics will help the results, no. A robotics with a good experienced surgeon.
Absolutely.
And experience in terms of robotics, not experience in terms of, suddenly what is happening is people who are doing TKRs are now purchasing robos, and suddenly their thing is not going to increase, because these machines have to be, you have to live with them. We are with them for the last 12 years. And I feel you have to understand the machine, and it is a learning process.
I think it's a passion with you, right?
And it's a learning process, ma'am. It is a very slow. You just can't buy a machine and start using it. I say, like, if I buy a Merc, I am not Louis Hamilton. Giving in his hands, he makes miracles. And for us, we can't go above 40 kilometers per hour.
Currently in Pune, with the traffic that we are
30
seeing.
30 kilometers per hour.
Truly. So thank you very much. Till we meet again and talk about another topic here.